I am pro breastfeeding, but I'm not anti-formula. I have also used formula 4. I find that the most difficult part, your back starts to hurt with time. It's so uncomfortable. It's called pest feeding. So there are ways to bottle feed a baby that's also breastfeeding in a way that doesn't affect your own breastfeeding journey. There's formula that they use for babies who are allergic to cow's milk. I breastfed my toddler who was 22 months when her brother was born, and a newborn. There's also something called lactation aggression. Breastfeeding increases your prolactin, which is a hormone that reduces your libido. Breastfeeding also causes vaginal dryness. It can be a bit of a burden. Sometimes it feels like a burden, like every time it has to be you, like it's only you. The baby reverse cycles and they start feeding all night, and all day they just wait for you. The fed baby is the best baby, but the thing is, no one was ever considering not feeding babies. Like the issue came up with comparing between breastfeeding and formula. So breastfeeding and formula, breastfeeding is better if you can do it. There's also pressure on people to stop breastfeeding, because at some point people start asking, you're still breastfeeding, you're still breastfeeding, you're still, that she's still breastfeeding. At the point that you want to stop breastfeeding, it is your right to do so. Hiya, my name is Sissy and I'm a mom of 3. I have exclusively breastfed all my 3 children for at least 6 months and breastfed them all to at least 2 years old. And the last one, I nearly reached the 3-year mark, which I did not, but was my goal. And in this video, I'm going to be sharing all I have learned along the journey of breastfeeding for the last 7.5 years. I feel like I've accumulated a lot of information about breastfeeding, and I don't know where to put it, so I'm putting it here in the hopes that it should help someone else, because my breastfeeding journey has come to an end. It's been 2 weeks now since I stopped breastfeeding. I tried expressing yesterday and there was actually some drops of milk, and I have a lot of feelings of sadness about it. It's like the end of an era. There's a lot of like grief, which is what sadness is about. Like sadness is, or grief is usually sadness which is due to a loss, and for me it's the loss of that time of my life. It's obviously mixed feelings because I am also very happy to have come to the end of this. Breastfeeding is a lot of work, and at the end of that day, I'm happy to be done. I don't have to consider my clothes every time I'm buying clothes. They have to be breastfeeding friendly. Like this shirt, probably I chose it because it was breastfeeding friendly. Every time I'm leaving the house with my child, that is, I couldn't go in certain clothes because at any moment you have to be easily accessible for when they need you. So there's a lot of pros to stopping breastfeeding. So that's what's keeping me going, because I keep feeling like I want to like do it again, but at the same time I'm like, no, I don't want to do it. And so anyway, it's been about 14 days now, and I believe this is really the end. I'm not turning back. I'm moving forward. So that's why I'm making this video to share the information as I've moved on from this phase of life. So the first thing is to go back to the very beginning, which is starting breastfeeding. So starting breastfeeding can be really difficult, especially if you're a first-time mom. I've had 3 kids, like I said, and starting breastfeeding was actually a bit difficult for all my 3 children, and I'm going to explain why. For my first, it was my first time. I didn't know what to do. And the thing with breastfeeding is that babies are born knowing how to suckle. If it's a full-term baby, you put anything in their mouth, they are going to suckle. So the babies automatically have it as a reflex. The moms, however, don't have breastfeeding as a reflex. We don't automatically know how to breastfeed like once you have a baby, and it can be really difficult. So for me, I was in hospital, I had a C-section, and I ended up in hospital for a few days longer than I would have if I had had a vaginal birth, and that really helped my breastfeeding journey, because if I'd been discharged earlier, I would be home where it was just me and my husband, and both of us didn't know anything. And I went to hospital with bottles, I went to hospital with formula, so I went with all these things as a backup. And even in hospital, I was given bottles to like express. I tried expressing, and I would give the baby, and the baby would take that very fine because bottles are very soft. It's easy. The mechanics of how to breastfeed, even for a baby, a bottle is easier than a breast. They have to kind of do more work. And so I was struggling to breastfeed. I tried the bottles with the expressed milk, and the baby was taking them. And they were the lactation consultants that would come and help you. So that lactation consultants would come and help me to latch baby on, and then it would be successful. And once they would leave, I would try on my own and I would fail. And it was so frustrating, but they kept coming back. We keep trying together, and then eventually at some point I got it. So I just wanted to share that because I didn't expect it. I thought it would be automatic, and it's like a learned skill. and eventually I learned how to breastfeed because I was in hospital and I had support. I think you don't have to have a lactation consultant, but I think anyone who's probably been a mom can advise you. So like I said, for me, going back home, I had my baby in London. We had no support like in that time. Like well, there was a few people, but they were not there the whole time. So they were not there to help me with the breastfeeding. So if you have people around you, make use of them, follow their advice, because the main thing with the starting of the breastfeeding is that you have to put as much of the boob into the baby's mouth, like the areola, which is the dark part. So for me, it was even too much, couldn't all go in, but at least as much as you can, just stuff it into the baby's mouth. That will minimize the discomfort and it shouldn't be painful. In the very, very beginning, the very, very first time you breastfeed, it does feel a bit painful because it's like, what is this? Like the suction is so strong. But then after a while, you get used to it and then it stops being like painful. But it shouldn't be super, super painful. If the baby is latching onto the nipple by itself, that's what causes actual pain and cracked nipples and bleeding and all kinds of horrible like things. So try and start off with the right track. There are lots of YouTube videos that show you how a good latch should look. I would recommend you look those up and have a look at that. Number 2 is to get the right position of breastfeeding, because then that minimizes your discomfort. Because a lot of times so for me, when I was in hospital, it was easy because the bed moves. So you sit up, there was plenty of pillows. When I went home, I didn't have like enough pillows. I didn't have a breastfeeding pillow, which is not essential. I don't think you need a breastfeeding pillow. And in fact, a lot of them are not comfortable, but you just need more support. So just having enough pillows so that you can bring the baby to yourself rather than you going to the baby, because that's what causes back pain and muscle pains, is if you're straining in some way your body. But if the baby comes to you, then you maintain a good posture. So maintain the right position, I think, is key, and get used to that, because you can easily get used to uncomfortable positions while breastfeeding. Number 3 is about milk supply. So as far as milk supply, I was blessed to have plenty of milk for all my babies, and especially in the beginning. And I think that's what it is for most people in the beginning, especially if you haven't had like major complications, is that your body produces way more milk than the newborn needs. And so as you keep on breastfeeding, the body regulates, it understands how much is being needed, so it will produce only what you need. So for me, in week 1 of baby 1, I was pumping because I had too much engorgement, and I happened to be in hospital where there happened to be pumps, and there were hospital grade pumps that are really strong. So that pumping too much also increased my supply, because it's like my body thought maybe I have twins, so the supply was too much. And then when I went home, I also got a pump, and so pumping a lot increases your milk supply, because your body just keeps producing, because it's a demand and supply kind of thing. The greater the demand, the greater also the supply will be. I did not have a special diet. The only thing I took that is one of the common breastfeeding things is bushera, which is a millet porridge. That's because I like it, and yeah, I really like it, and maybe it helps, I don't know. But at some point, especially after my first baby, like in the second week, I even stopped taking it, because I went to stay with my uncle and aunt, and they were giving me bushera. I told them, please reduce, because I was worried that I have too much milk. It was making me so uncomfortable, and yeah, so I tried to take even less of it. But I don't know, I don't think it's the bushera. Anyway, I don't know. But I feel like you don't need a special diet. I feel like you should just eat normal food that you enjoy, and also drink plenty of water, and also rest, and not being stressed, because I wasn't stressed for most of my kids after, except the third one. I was a bit stressed because they were in NICU, then they were in special care, so that was really stressful. And then also I had a complicated operation. I lost a lot of blood, so my milk supply was down from the get-go. So that's my recommendation. So I don't have specific special foods I would say you need to take. I think regular normal food works. As long as you're eating food that you're enjoying and drinking plenty of water, that should help. Yeah, and I guess the bushera for me is the only thing that I took that will be a special breastfeeding food. But I feel like if you like it, take it. Also, if you like the things, take them. Don't do things like as if medicine. I feel like that creates more stress. Like you're not enjoying what you're eating because they told you, oh, you must eat, eating some rare thing you've never even heard about, all in the name of breastfeeding. milk supply. So the next thing is rest. Rest is really important, and you need to be resting because your body is producing milk. Your body is tired. Your body has been through a lot. No matter whether you had a vaginal delivery or a C-section, it's a lot. So you need to heal. But especially if you had a C-section, it's a major abdominal surgery. So you need to rest if you can. I would recommend resting. I am very grateful that my husband has always been there and does everything, and I just sleep and he just brings the food, he does everything. So for me, my job is to just breastfeed the baby and sleep, and I'm so grateful for him. And if you're back home in Uganda or elsewhere where you can have more support, make use of that support that you have. If you can have a maid, please have a maid. If you can have a night nurse, go ahead, please. I would recommend getting as much help as you can because that time of your life is so critical. It's so potentially difficult. It's so stressful. And also it's a short time in the grand scheme of things. So even when you're in it, it feels also consuming. But actually it's not that long when now like me who has gone a bit past it. So you want to get as much support as you can then. Even if your partner is not super hands-on dad like mine, of which I'm really sorry, but you can make use of this support of other people. Just get help. If you're in the diaspora, maybe like the UK where we have much less support, I'm really sorry, it's so tough. My recommendation would be to lower your standards. If you are washing clothes, you know, like laundry and then ironing, like why ironing? Maybe cut out the ironing. Personally, I don't iron like almost ever. I iron very few clothes that are very obvious, and some of them, even if they're obvious, I don't mind. I feel like if you're postpartum in the diaspora, you don't have much support, just reduce on the things that reduce your standards. Like if you're constantly cleaning, reduce on all that, because you are the priority in this moment. Try and take care of yourself in the way that you can. Number 2 is safe co-sleeping if you are comfortable to do so. So for me, I co-slept with all my babies, except the third one. I waited a little bit because he was preterm. I've made another video on safe co-sleeping, and so in that video there was everything I shared that I knew about co-sleeping safely, and one of them is about preterm babies. It's a bit more risky to be co-sleeping with preterm babies, but one of the things where co-sleeping is more safer is if you're breastfeeding. A breastfed baby is easier to co-sleep, and it's safer because the baby can smell your milk, and so that keeps them in that position. And usually you will automatically adopt a position where maybe you're sleeping like this, and so this keeps baby here, and then normally you curl up a little bit, so then your baby is safe between your upper arm and then your legs, and so they're not going to like go under the covers and like maybe suffocate or something, because that is the main fear of co-sleeping, is suffocating babies. So anyway, for me, I co-slept with all my babies, and I found it really helpful for my breastfeeding journey because first of all, it helps with your supply, because after a while when your baby is bigger, then it becomes like all night buffet. They just feed constantly, and then you get more sleep because at some point they can just latch on by themselves, and then you don't even wake up or you don't even realize you've woken up. And studies have shown that mothers who co-sleep with their babies and are breastfeeding tend to report feeling more rested, and we feel like you've slept more than if you have to keep on getting up, putting the baby in, getting up, putting the baby in like another bed. So for me, also co-sleeping is acceptable in my culture. So that's something else I think I should mention to anyone out there who might be maybe in another culture, like maybe cultures in the UK, like white British people who maybe to them it's very normal for them to leave their babies like from like 6 months. It's even what they recommend is after 6 months, put the baby in their own room, which is just so unacceptable to me personally, and is backed by my culture and my ancestors who have been co-sleeping for generations. The next thing is that exclusive breastfeeding when they're still like up to 6 months is a lot of work, but at some point it becomes easy. Like by the 6 month point, for me it was so easy. And when I now started weaning, whereby by weaning I mean introducing solids, not stopping the breastfeeding, I actually regretted getting into this phase of now food, because first of all, my first child was such a fussy eater. Even from 6 months old, she never liked a lot of things. She would just spit out things, and I was so stressed, and I was like, I can't believe now it's something else I have to worry about. Unlike before, when it's just breastfeeding, that's all. Breastfeeding is the only diet they have. And I feel like if I had known that when I was still in the earlier months of 0 to 6 months, that actually weaning is also work. You have to cook the food, you have to prepare the food, mash the food, give them, then you have to start thinking about breakfast, lunch, supper. Like, it becomes a lot of work. I would enjoy that time where it's actually worrying about your own meals only and then just breastfeeding. The next thing I want to talk about is pumping and storage. So I pumped at some point for all the 3 kids, and pumping is a lot of work because you have to sterilize the bottles, then you have to get like the storage things, then defrosting, then the milk has all these rules. Like, for instance, once it's fresh, you must use it within 4 hours, I think. Then if it's in the fridge, it also only lasts a certain period. Sorry, I've forgotten. And then in the freeze, a certain period. I found it quite stressful, but I had to do it at some point because I had no choice. So for my first baby, I pumped from the get-go, and I ended up getting tired and I didn't have a stash. By the time I went back to, not work, I went back to school, my first baby was only 2 months old, and I didn't have a stash because I had gotten exhausted by the pumping, and I was now feeding from the source only. And I had to pump every single day. Like, I would pump, and then I leave the milk and I come back the next day, pump. But by the time I would come back, the milk is finished. Like, my supply was not keeping up to the demand. And at that point, that's when we introduced formula. So at 2 months old is when I introduced formula. And my baby is one of the ones, she could tell the difference between, so we're using Aptamil, I think. Is it Aptamil? One of the common ones. And it comes in powdered form, but also it comes in liquid. She would only have the liquid, which has been pre-mixed. If you make it by yourself, she wouldn't take it. Yeah, so I guess the point here is mostly about pumping and how pumping is a lot of work. And for my second baby, I pumped only a little bit and I just got fed up also. So in the end, I pumped maybe only 1 week and I stopped. For my third baby, I had to pump for much longer because they were in NICU and special care. So I was pumping regularly. And then after pumping, storing the milk in the NICU fridge, you had to label it. It was all very serious. Sterilizing the things, the pumping parts. It was so intense. But luckily, after the first week of pumping and breastfeeding, actually we were discharged quite soon, after about 1 week in hospital. And once I went home, I stopped pumping because I was tandem breastfeeding. So my older daughter, who was 22 months, became like my pump, where the milk was too much for the newborn. So she would come and she would breastfeed, and so that was the end of my pumping journey. The next point is about formula. So I am pro breastfeeding, but I'm not anti-formula. I have also used formula for not all my kids. I used formula for only my first and my second, because so for my first, I used the formula because I went back to school and my milk was not enough for her because I couldn't keep up with the demand. And I wanted to just advise to delay formula as much as possible, because sometimes, especially in the very beginning, when your breast milk supply has not been fully established, introducing formula early can affect your milk supply because you're not giving your body the chance to do the feeding, and so it will not produce as much because it doesn't sense the demand. Secondly, there's also the nipple confusion that happens. So if you're going to breastfeed a baby and also give them formula, I would recommend giving them formula in a bottle in a way that is breastfeeding friendly. So first of all, the bottle itself, the nipple should be the kind that is kind of similar, a slow flow one, not one that's too fast. Because if it's too fast, then that's not similar to breastfeeding, and so the baby can easily prefer this very fast one. So you have to use a bottle that has a slower flow. Also a nipple that's wider, like the teeth of the bottle should be wider. You can look up breastfeeding friendly bottle feeding and find out more, but I would recommend that because that's how the confusion happens. There's something, it's called pest feeding. So even when you're feeding the baby, you don't give them too much at once. You don't turn the entire bottle constantly if you're bottle feeding a baby who's also breastfeeding. So there are ways to bottle feed a baby that's also breastfeeding in a way that doesn't affect your own breastfeeding journey. Another thing is the very beginning, like in week 1, I've heard of people going to hospital with formula, like myself. I went to hospital with formula and the baby being given formula like very, very soon, and that will also affect your breastfeeding establishment. So for my third baby, who was preterm, I was told by the midwives, can we give the baby formula, because I was going to be unconscious because I had general anesthesia before you you're conscious. I said, no, thank you, give them donor milk, because I knew that once you start formula, it's very hard to turn back. First of all, it's very hard to come and start saying, oh, you know what, no, please, can I have donor milk? No. And also, the baby gets the taste and all that. And for me, in my case, 2 of my kids were allergic to cow's milk, so could not even have regular formula. And I'm glad I didn't start the formula earlier, because they would have reacted even earlier. For baby 2, I did use formula, but it was a special one. And for a little while, because there was formula that they use for babies who are allergic to cow's milk. So it's processed in a way that the body is broken down so much, like the protein in the milk is broken down so much that your body won't recognize it as cow's milk. But it smells so bad. And so she didn't like it, and we stopped. And what I did now was to cut out cow's milk from my own diet, because we're trying to eliminate cow's milk completely and see how it would affect her. And I said, let me try and give her formula so that I can continue taking cow's milk. But in the end, I had to give up. And actually, I now don't take cow's milk as much as I used to, because I've lost the taste of it. Like even in like tea, I hate cow's milk. I use now oat milk. Another thing that I would recommend, by the way, is eliminating cow's milk from your own diet as well, and look up the signs of cow's milk protein allergy, which is what my kids have. Is that it causes things like reflux. It causes a baby to over reflux, you know, that kuoga, where they bring back too much milk. It causes them to be irritable. Their tummy is hot, which can look like colic. It causes skin issues. They can be itchy. It causes many things that actually, if that's the cause, that cow's milk, which is through your breast milk, then if you just stop the cow's milk, they would get better. So that's something I learned along the way. The next thing I want to talk about is tandem nursing, which is that I tandem nursed. I breastfed 2 babies at the same time. I breastfed my toddler, who was 22 months when her brother was born, and a newborn. Until I did that for only 6 months, because I got to breastfeeding aversion, which is where so breastfeeding aversion means when a baby latches on, you feel very, very bad. It's extremely unpleasant. And I had that experience when I was pregnant. So I think it's a natural thing that happens to try and maybe tell you to stop it, where you're still insisting on breastfeeding. But I can override my brain, and so I can override my body. So for me, I read up about it, and I knew that actually this can go. And indeed it went. So that phase passed, and there are techniques to try and manage it. I would recommend a website called Kelly Mom. It's a website by someone who is an IBCLC, like an international board certified lactation consultant. And it has a lot of articles about all kinds of things. So the breastfeeding aversion caused me to stop breastfeeding the toddler. And I had breastfeeding aversion only towards her. When she would latch on, I would feel very uncomfortable. But when the 6-month-old would latch on, I wouldn't. So the human body is so amazing. God made it like that, that it was time. I just knew it was time to stop breastfeeding her. I would also recommend you read a lot about various things that happen in breastfeeding. Like there's something else called breastfeeding dysphoria, which is where when the baby latches on, you become sad, like low mood. You feel like maybe some people even have suicidal feelings, like they just feel their mood is so depressed, and can be so intense. There's also that. There's also something called lactation aggression, which is where breastfeeding, because of the hormonal changes it causes you to be more aggressive and irritable, and so you become more. So these changes happen in everyone postpartum, whether they're breastfeeding or not. But if you're breastfeeding, it's even worse. So there are cons to breastfeeding that you should be aware of. A lot of them, I think, have solutions, but I just thought I would share some of those now. So first, I've talked about the hormonal changes that might cause irritability, low mood, all that. And the other thing I want to talk about is libido. So breastfeeding increases your prolactin, which is a hormone that reduces your libido. And so you have less interest in sex, which I think is okay. Because usually you're not interested in, like, I feel like you have so much going on. But anyway, this can go on for a while, especially if you're breastfeeding for a long time. Now, like me, who breastfed for so long, like almost 3 years, you have less interest in sex. And then breastfeeding also causes vaginal dryness, So vaginal dryness can happen because of breastfeeding. So you should be aware of that. Ways to manage that is using lubricant, but also there are estrogen creams that your GP can prescribe that can be helpful for breastfeeding related vaginal dryness. The other thing is time. Breastfeeding takes a lot of time. Like, you have to be there. Like, if you have to leave home, you know you have to be back by a certain time because you're breastfeeding. Like, it really grounds you, and it's a sacrifice I think that people make, that mothers make. And so it's not all like smooth sailing. There's also that it can be a bit of a burden. Sometimes it feels like a burden, like every time it has to be you, like it's only you. Especially now, like for me with the first baby, I was expressing and bottle feeding, but at some point the baby refused the bottle, and then now I had to always be the one to feed her, which was so frustrating every single time. And at some point, even when I left to start going to school, I would leave her with my mom, and my mom had come to help, and she completely refused the bottle, that she'd wait for me all day, which is something called reverse cycling. It can happen at any age. Usually when moms go back to work, the baby reverse cycles and they start feeding all night, and all day they just wait for you. Which like the baby won't starve to death. Like, if you give them a bottle and they're hungry, they will take it. If they're not hungry enough and they insist on you, they'll wait for you, although they'll be crying and irritable because they're hungry. So it's quite frustrating. So that happened to me with my first baby. The next thing I want to talk about was breastfeeding beyond infancy. So there's a lot of pressure for people to start to breastfeed in some countries. Like Uganda, there's a lot of pressure for breastfeeding, much less than the UK, where the motto is fed is best, which is a bit of a weird motto also, because fed is best is like the fed baby is the best baby. But the thing is, no one was ever considering not feeding babies. Like, the issue came up with comparing between breastfeeding and formula. So breastfeeding and formula, breastfeeding is better if you can do it. So we are not saying that either breastfeed or starve the baby. Of course, formula is also an option. So that's why fed is best usually means they're referring to formula being maybe best, I don't know. But there's that narrative, especially in the UK. So the breastfeeding rates are very low. I think I saw that all the statistics are like only 1% of babies are still being breastfed by 6 months. Something like that. Like, people give up very easily. So in the UK, I think the narrative is not as much. There's not a lot of pressure on people to breastfeed. But in like Uganda, there's a lot of pressure on people to breastfeed. And there's also pressure on people to stop breastfeeding. Because at some point, people start asking, you're still breastfeeding, she's still breastfeeding. And I find it very annoying, especially as a breastfeeder. But so you have to be ready. If you're trying to, if your aim is to breastfeed beyond infancy, beyond like 1 year, you want to reach 2 years, 3 years, 4 years, I think do it if you want to, because there are a lot of benefits also. First of all, it's easy. It's like a magic fix to anything. Baby's crying, just breastfeed them and they just stop. Something like they're having a tantrum, just breastfeed them and they stop. I found it really convenient. It's still helpful for the babies, for their immunity. I would recommend that you first see if you can fix the problems that you have. Maybe if you need to see a lactation consultant, if you need to get some help, or you can try and persevere a little bit. But there comes a point when you feel like actually you've had enough. Whenever that happens for you, you don't have to have the same goals as other people, because some people, like some of us, wanted to reach 36 months. Some people want to reach 1 year. Some people want to reach 6 months. Whatever your goals are, at the point that you want to stop breastfeeding, it is your right to do so. You can do it, especially if it's not working for you anymore. Try and release yourself of any guilt, because there might be some guilt that maybe, oh, you should go on, please. If you want to stop, just do it. Stop. Ways to stop: you can stop cold turkey or gradually. With my first baby, I stopped cold turkey, which means I just stopped and never breastfed again. And it was very traumatic for me and for her, because the very first time I breastfed her was, I remember it because like we had stopped breastfeeding, now we have stopped. She would cry, she cries. I said, no, sorry, she cries. And then one day we were sleeping, and then she started breastfeeding, because even me, I didn't realize, it was kind of automatic. We were so used to it. And then my husband came and said, we said we are stopping this. Then he grabbed her, and so he pulled her off of my boob. And that made me so pain. So it caused me a lot of pain. and that's why now with other kids I tried not to do that. With my second baby, I stopped gradually. So because she was 2.5 years old, and for her she was talking and understanding, we had to count down. We would say we're only 5 minutes, only 10 minutes. For first only 10 minutes, although it never reached 10 minutes was too much. I would just count to 10, then counting to 5, and then she would also say only 5. We count 1, 2, 3, 4, 5. So gradually reduced. It was really hard for her because I was also breastfeeding her brother at the same time. So she would get reminded, like she would see me breastfeeding someone else, where can I also breastfeed her? But in the end we stopped. And then with the youngest, I just put plaster on my boobs and I told him bele ouchi, because he would say, mommy, bele please. So I said bele ouchi. I showed him and he saw, and that was it. He just came back once. He comes back once in a while, but he hasn't come back in a few days now. And he would say belly, and then I would say ouchie, and he moves on. And I didn't have a lot of engorgement. I had very little engorgement, extremely little, almost nothing. And I think the breast milk had already dried a lot. It was very little left anyway. So, and he was old enough. So that was the easiest breastfeeding stopping experience so far. I have talked a lot in this video. I hope you found it helpful. If you did, please let me know down below what you found helpful. The last thing I wanted to reshare is about the co-sleeping. So for me, co-sleeping was the #1 most helpful thing. For me, it's made me breastfeed even longer. And in fact, when I stopped breastfeeding all my kids, I first stopped by breastfeeding the night time. I stopped the co-sleeping at night because I find that the most difficult part, your back starts to hurt with time. It's so uncomfortable. So I stopped co-sleeping with them, but they co-sleep with their dad because they're still used to sleeping with a human and having that warmth with someone. So I usually stop co-sleeping with them at age 1, which is usually when I go back to work. And it's when I start working night shift. So it's easier for me because I'm just not there the whole night. And so after the night shifts, I still don't go back to the bed with the kids. So the kids continue sleeping with their dad, and then me, I sleep elsewhere. And that's another way that I've been able to breastfeed for so long, by the way, is because I stopped the night feeding at age 1, and then I only feed in daytime, which is easier. So anyway, in this video here, I shared all about safe co-sleeping. So make sure you watch that.